We'd arranged to meet Stephanie and her family at a park in Austin. Then she said she'd bring some others too. Because fentanyl has broken so many here.
We lost our son, Tucker Rowe.
My granddaughter, Victoria Joanne.
I lost my son, Stephen James.
On February 17th of this year.
He was 16 years old.
17 years old.
Make no assumptions about this drug. There is no typical victim. It is a poison, and it is killing young Americans up and down this country.
And she took maybe what she thought was a Xanax.
To a pill she was trying to use to relieve her anxiety and sleep.
That was unfortunately laced with fentanyl.
We found her the next day.
We were, 20 feet down the hall asleep while she passed away, and we had no idea.
You can take your pick of devastated communities here. Just to the south of Austin is the town of Kyle, and we're out with the local police chief.
This started less than 18 months ago, and when it did start, it came with a vengeance, and it struck multiple families just in a matter of months, sometimes a matter of weeks.
We're a couple of hours here from America's southern border.
What is in Mexico now, in a few short hours, can be in the hands of our residents here in this part of the state.
In schools like that?
In schools like that.
Last week, a child overdosed in this classroom. It is tragically telling that they knew what to do.
So when we get called to a classroom. Usually you can tell there's a sense of urgency over our radios when we're listening. So when we get there, we look at the students. Sometimes they're blue. They're not responsive by any means. They have the death snore. It's really scary to hear. We just give the Narcan as quick as possible, get them on the ground and make sure there's a pulse. If not, we have to initiate CPR. Sometimes, or if there is a pulse, we can kind of resuscitate them back with rescue breathing.
Goodness. And is that student okay?
As far as I know, yes.
The young girl survived thanks to this, a reversal treatment, Narcan. They keep it on hand. But often it's not enough. In this school district, they have lost 5 students since last summer. Children.
It could be anybody close to you, it could be anybody around you, and it just hurts knowing that it could be you.
You know, COVID and the depression, the anxiety that children faced and that people are still living with today, and that combined with this relatively easy to get and lethal drug is really what's causing it to be so hard on our community.
Jerry Scrocky is the school district security director.
I think we're being successful on that first-time user. I think that they're getting the message, and I think that parents and those kids are heeding us. Where I think we are not reaching is those kids who already are addicted. And I think that goes back hand in hand to the lack of resources.
And the lack of mental health treatment.
Absolutely.
But you can feel the heaviness here, a burden beyond anything they should face.
Nobody wants to be working an overdose on anyone, but let alone a child. And it happening in the middle of a school day. It's just, sorry, it's rough.
Yeah, it really is.
This stuff is a game changer because you're dealing with sometimes 14, 15, 16-year-old kids that are dying from just one blue pill.
Sergeant Tommy Villanueva leads the drug busts in the community. He doesn't want to be identified, but he can reveal what they've seized.
These are the pills that the kids are taking?
Those are the most popular ones that we're seeing. Yes.
Sometimes they're cutting them in half or a quarter, or just taking a sliver.
Correct.
Do you feel, Tommy, that this is a battle you're winning? Are you getting on top of this, or are you up against it?
No, sir, we're up against it. We're not winning it at all. We're managing what we do have and what we do find and the information we do get. But no, we're not winning. There's just a small fraction of what is here, what we've seen, what we've seized.
Back in Austin, in the park, dusk, and they were still telling us their stories.
But it's the drug. The drug is so addictive and it's so powerful and it steals lives. And that's what it did to our son.
He was a great big brother, and he was just always there.
They are bound by grief and a drug that's killing Americans in record numbers.
We're going to continue to fight and honor his name. He will not be just another statistic, not as long as I'm living.
Mark Stone, Sky News in Texas.